Protecting yourself while going out to eat. The mask debate now taking center stage at local restaurants.
In a special Full Circle report, we look at the best ways to protect yourself while eating out and a suggestion for diners who don't like wearing masks. As restaurants reopen across the Bay Area, a new debate.
So I care about the community. I know COVID is hitting everyone really hard right now, especially older people.
Anthony Price says he got COVID-19 a couple months ago, recently testing positive for the antibodies.
I still wear a mask just in case, we never know what this virus can do.
22-year-old Hayden Miller sees it differently.
Honestly, I would prefer not to wear a mask. I get they do help, but it is kind of frustrating having to remember it and take it every single place, and especially in the Tampa heat.
But now, wearing a mask is a requirement in some cities and counties, a mandate embraced by some restaurant owners.
All of the data that we're learning and working with Advent Health is that masks are your #1 safest way to prevent the spread of this disease.
Jeff Gigante owns Forbici Modern Italian Restaurant in Hyde Park and enforces not just the mask ordinance, but says he put in place strict safety procedures for both his staff and customers.
We ask them to use hand sanitizer when they come in. We take their temperatures. We ask them that they have masks on. If they don't have one, we provide it.
And in June, Gigante announced one of his own employees tested positive for the coronavirus. Gigante says he had to be forthcoming in order to protect everyone.
I've been doing this for a lot of years, as you know, in our community. And I've always made our way by being transparent and being open and honest with our customers as well as our employees.
And if a restaurateur is not enforcing the CDC rules, Gigante says owners should be extremely aware of the risks they're taking.
To jeopardize people's health, whether it be their staff or their customers, right now for the short gain is not the way to be.
If you want to wear a mask, wear a mask. I just don't think it should be mandatory.
Kelly Snow owns Snow Shack in Palm Harbor and works at a local Chick-fil-A doing PR. So when the Pinellas County Commissioners voted in June to make it mandatory that everyone must wear a mask when inside a business, Snow strongly disagreed with that ruling.
They're infringing on our rights. And I know that probably sounds like a soapbox saying as an American, but that's how I feel.
Snow feels the commissioner should not have made such a quick decision in using the word mandatory, but instead
recommending strongly. And then maybe moved, a little bit more.
Snow says she and her employees all abide by CDC safety guidelines, including wearing a mask, but says she thinks the information coming out about COVID-19 is confusing and constantly changing.
And there's changes every day. There's so many changes, of what works and what doesn't work and what happens and what doesn't happen and what causes and what doesn't cause.
But scientists and medical professionals all agree masks do work.
So we know that they restrict, again, infectious particles from coming out while we're breathing.
Dr. David Wein is chief of emergency medicine at TGH.
There's a number of studies that show that transmission, the amount of droplets that are spread, are decreased by wearing a mask. So that if we're spreading less droplets, we're less infectious.
And Wein says masks have proven to work before, during other pandemics. These photos were taken in China, where passengers wore masks to protect themselves against SARS back in 2003.
And then if we look at countries that have used masking in a widespread way and have maintained other aspects of their economy, several Asian countries, we see that they have lower infection rates.
But as Florida's COVID-19 numbers began to spike, Governor Ron DeSantis did not mandate masks, but vowed to crack down on businesses not following safety guidelines.
If you're not willing to do that, then you're going to get a visit here from, I guess he'll be kind of the grim reaper in terms of business licenses because there's not going to be any tolerance for it.
He's talking about Hal Beshear, head of the state's licensing agency, which inspects restaurants and bars.
We'll be suspending their license.
He promised swift action against rule breakers.
Those that are in flagrant violation, we have ABT officers that are going to be out from now on from 5 p.m. to 1 a.m. checking on these bars and restaurants that are in violation of this.
But just 3 days later, Beshear shut down all bars for on-premise alcohol consumption, writing in this order that non-compliance by bars throughout the state was suspected to be so widespread that enforcement was impractical and insufficient at this time. Local officials have also been inspecting restaurants. St. Pete Police sent us this list. It includes restaurants cited for employees not wearing masks. The penalty? A $100 fine plus $18 in court costs or argue before a judge. But if that judge finds you guilty of the violation, the fine could increase up to $500.
They've been required to wear masks since the very beginning.
Across the bay in South Tampa, Suzanne Perry is co-owner of Dad's on McDill and says enforcing the mask rule has not been easy.
When a customer enters the door, we ask them please to wear a mask, and they're not used to being asked to do that. Not all of them love it. Some of them don't want to do it.
But Perry says the masks are also for the safety of her own staff.
Sometimes a customer might be asymptomatic, and I don't want my servers exposed to that either.
Perry says she pays over $1,000 a week to buy masks for all her restaurants, a cost she says is worth the price of safety.
I will allow the servers to take off the masks when the scientists tell us it's safe to do that and that we have stopped spreading COVID.
But I do believe that everybody who is forward-facing or front-facing with customers should be wearing masks.
Danielegger, a former Florida health inspector, now consults restaurants on food safety issues, especially surrounding COVID-19 and the use of masks.
It is not a law. It is a CDC recommendation. However, it is a strong recommendation, and the studies have shown that it does help with the reduction of pathogen spreading.
And the biggest mistake Egger sees with mask wearing? Leaving your nose exposed, like this.
Those respiratory droplets will still have access to our nostrils.
So the right way?
You're going to put it around your nose and around your mouth, wrap it around your ears, pull it down around your chin. Try not to touch too much of the mask. And of course, pull it up over your nose and kind of push it down like that.
And any restaurant not in agreement in wearing a face covering, Egger says, consider this.
These are your customers. These are paying customers, and they count on you in normal circumstances to practice safety standards and hygiene standards. And you are held to a higher standard because you're serving them food, and you do have a risk of getting somebody sick.
And for diners who hate wearing a mask, Egger recommends sitting outside.
There were cases investigated in China that did indicate that the respiratory droplets had been spread through the air conditioning. So the fresh air definitely helps.
As new COVID-19 cases and deaths continue to rise, the White House's top infectious disease expert, Dr. Anthony Fauci, has indicated wearing a mask might be the only thing that saves any state from going into lockdown mode again.
And those people who don't want to implement the strict adherence to masks, I think are going to cause all of us a lot of pain.
Now, we know that was a lot of information, so we'll be posting this full circle story on our website at abcactionnews.com.
It's also on our free streaming news channel as well if you want to rewatch it or share it with someone else.